I should introduce myself. My name is John Morris, and I'm the co-director of the Knight Alzheimer Disease Research Center here at Washington University School of Medicine. And it's a great honor to welcome all of you to this conference on enhancing participation by minoritized groups in Alzheimer's disease and related dementia research. Just some housekeeping details before we start. First, please turn off your devices. Second, for restrooms, exit either doors, but go that way. The end of the hallway that way has the restrooms. Three, if any of you parked in our garages, we do have validation for parking, and the people at the registration desk can let you know about that. And then last, there's a QR code in your program, and if you would please look at that when you are leaving the conference and be able to access it so you can provide an evaluation. That would be very helpful for us as we're planning future conferences. With that, I'd like to begin the program by introducing the Provost and Executive Vice Chancellor for Academic Affairs at Washington University, Beverly Wendland. Provost Wendland received her doctoral degree in neuroscience from Stanford University and then joined the faculty in the Department of Biology at Johns Hopkins University, where she explored fundamental cellular processes using a yeast model system. She became chair of the department, and then in 2015, she became dean of the Krieger School of Arts and Sciences at Johns Hopkins, and she increased the diversity of the faculty and established more inclusive environment. We were fortunate in 2000 to attract her here to Washington University, where she became the provost and is responsible for the academic enterprise. Provost Wendland is very much dedicated to inclusiveness, and with the Chancellor of Washington University, Andrew Martin, have made great strides in ensuring that Washington University can be accessible to every qualified student. So if you would join me in welcoming Provost Wendland to the podium.
Thank you, John, and good morning, everyone, both those of you who are here and for those who are streaming through the internet. So it's my real pleasure to be here with you at the Knight Alzheimer's Disease and Related Dementia Conference. It's my sincere pleasure to welcome all of you joining us both in person and remotely. Last night, we hosted the 18th annual Norman Say Lecture, which commemorates the work of a pioneer in community-engaged research. I hope that many of you were able to attend that event. Last year, I had the privilege of providing remarks to open the 17th annual Say Lecture, and at that time, we had just unveiled WashU's strategic plan, Here and Next. With our strategic vision, we aim to mobilize our research, education, and patient care to establish WashU and St. Louis as a global hub for transformative solutions to the deepest societal challenges. Now, I've been reading that vision statement for well over a year now, and I have to tell you that the excitement that I feel about it still has not diminished, and I still feel goosebumps every single time I think about it. And what still stands out to me as I reflect on that vision statement is how prescient the work of someone like Norman Say truly was, and how important the work of the Alzheimer's Disease Research Center is, and how much it matters to have leaders like John Morris here, and all of you being here matters a great deal as well. And why is that? Because you can't say you're going to establish WashU and St. Louis as a hub, as true partners, as true teammates, if you aren't centering authentic collaboration. True, meaningful collaboration is intrinsically tied to responsible, sustainable partnerships, like those that Norman Say, honored last night, worked to forge. It rests on partnership and collaborations that the Alzheimer's Disease Research Center holds dear. And you can't say that you're going to create solutions to the deepest societal challenges if you're only talking about solutions for some people, or the challenges that only face some populations. That's in part why we're here, isn't it? This conference is about enhancing participation in minoritized groups in Alzheimer's disease and related dementias research. That participation matters. That participation is meaningful. Without full, authentic participation, you don't get transformative solutions. You get Band-Aids, and you get people who are left behind. I want you to know that I know what this conference is doing matters a great deal. Participation and partnerships matter. It all rests on an unwavering commitment to equity, diversity, and inclusion. Our work must flow from a place of partnership, collaboration, and commitment. Commitment that we will serve our communities through our research, our education, and through the care we provide as we break through and break down the barriers to equitable access for all. This conference, alongside so many efforts here at WashU, in St. Louis and beyond, represents one way that we work to address health disparities and equitable access to positive health outcomes. That we truly can work together to establishing WashU and St. Louis as a hub. That we can work together to pursuing those transformative solutions, and that we can work together to solving, not just for some, but for all, those deepest societal challenges. So I thank you so much for being here, for the important work that you're going to be doing today and tomorrow, and I hope that you have a successful and wonderful conference. Thank you for allowing me to start you off this morning.
Thank you so much, Provost. That was wonderful. So let's begin the conference with the land acknowledgement. People of the Osage, Missouri, and Kaskaskia nations in the Illinois Confederacy were removed unjustly from their homeland, and Washington University now occupies some of that homeland. We also want to endorse that this conference is going to be conducted in a safe and respectful environment. All individuals have the right to enjoy an environment free from forms of conduct that can be considered harassing or discriminatory. Academic freedom can only exist when every person is free to pursue ideas in a non-threatening atmosphere of mutual respect. All attendees of this conference should work together to ensure that diversity, equity, civility, and inclusion are appreciated, especially in the context of engaging historically minoritized communities. The differences, as well as the commonalities that bring us together, call for civility and respect in our personal interactions. This conference has many supporters, and I particularly want to acknowledge the National Institute on Aging that provides a grant that is the centerpiece of the funding for this conference. The Alzheimer Association also has provided substantial financial support, as has a very generous donor, Cindy Cummings. But we also have had support from the National Alzheimer Coordinating Center, the St. Louis, Missouri chapter of the Links Incorporated, the Knight ADRC's African American Advisory Board, the newspaper serving the African American community called the St. Louis American, and the Co-Equal Governance Board. Now, it takes many people to put on a conference of this magnitude, and in fact, the entire Knight ADRC, to some extent, has been contributing to ensuring that this conference goes successfully. So I want to thank everyone in the Knight Alzheimer's Disease Research Center, many of whom are circulating around in a helpful manner. But there are certain people who really took the brunt of the leadership for this conference. So I want to acknowledge Andre Denny, Murda Spencer, Jennifer Phillips, Dottie McDowell, Joy Ballsbury, Ron Hawley, and Krista Motor. Will you join me in thanking them for their organization? Part of the Alzheimer's Association fiscal support for the conference enabled us to have travel scholarships for early stage investigators, and they're listed here. We were really pleased to have some 26 applications. We were able to fund these 12 individuals, but all the applicants really were worthy. But we'll give the awardees here another round of applause for their efforts. And the specific aims for the conference are as such. So we want all National Institute on Aging funded Alzheimer's disease research centers and related programs and related interests to try to come together so that we can use uniform definitions and nomenclature, incorporate measures of social determinants of health in research protocols, implement evidence-based recruitment and retention strategies to improve the diversity of ADRC cohorts, and develop strategies to reduce disparities. We had an earlier conference in 2018 on very much the same topics, but it was limited then to Black and African American individuals. So this conference is expanding so that we can include all historically minoritized groups, at least to some extent, as shown here.